Ladies and gentlemen of the Congress, I am here today to address the issue of our declining healthcare performance as reflected on the 2014 National Scorecard. I'm going to focus on the scorecard indicator of prevention and treatment. Since 2007, we have seen a striking decrease in our overall score for prevention and treatment in the U.S. We have had a significant increase in the number of adults uninsured, with a concurrent increase in the number of adults who went without needed care due to cost. At the same time, the number of adults who had regular access to primary and usual care decreased significantly, as did the number of adults receiving a complete bundle of preventative care, which includes things like cancer screenings and flu shots. It is important to note that these changes occurred prior to ACA and that there was an economic recession during part of this time. As you can see from this slide, for some of the indicators, the U.S. showed improvement. For instance, more children are receiving recommended vaccines and more hospitals are providing discharge instructions to help with home recovery. But we are doing much worse in many important indicators, such as 30-day mortality, receipt of recommended preventative care, and elderly patients receiving contraindicated medications. This is not acceptable. Let us focus on one particular performance indicator, namely the number of adults aged 50 and older who received appropriate screening and preventative care. In this first chart, you can see that we have a rate of 51%, with our target being 80%. This is an improvement over 2009, as you can see in this chart. But what is more shocking is that in 2014, we dropped back down to 42% again. To put this in simpler terms, if you look in your row, only 4 out of 10 of your seatmates will have received preventative care, while the other 6 have not. This is shameful. We have had some mixed successes and failures. With this most recent scorecard, we are doing some things right. For instance, the CDC Vaccines for Children program has been instrumental in increasing the rates of vaccination. The reauthorization of SCHIP has played a role in the improved health of children. Medication programs such as electronic prescribing and new Medicare reimbursement programs based on quality care have been positive for adults. But it is not enough. Our successes pale in relation to our failures. We have been underinsuring adults while increasing the expense of health care. We have large cost-related barriers to care with increases in premiums for employer-sponsored insurance. In spite of rising costs, we still have inconsistent quality of care and increased health disparities. I am urging you, as members of the New York State Congress, to vote in support of single-payer universal health care, starting with New York State. On April 4th of this year, I attended Lobby Day in Albany for the New York Health Act, organized by the Campaign for New York Health. I participated in a rally outside of the state capitol and had the pleasure of meeting with aides from the offices of Senator James Seward and Assemblyman Clifford Crouch. While the New York Health Act has been around since 1992, few New Yorkers have heard of it. The bill passed through Assembly in 1992, again in 2015, 2016, and 2017. This bill is a guarantee that all New Yorkers receive health care while also cutting health insurance costs. Under this act, over 1 million uninsured New Yorkers will become insured, with a net savings of $45 million. 98% of New Yorkers will pay less than they do now for insurance. Currently, 1 in 3 insured New York families have delayed or skipped medical care because of cost. Under the New York Health Act, this will no longer be an issue since everyone will be fully covered. People accuse this act of being socialized health care, but it is not. It is a single-payer system which allows New Yorkers to choose their own hospitals and doctors, putting control back into the hands of patients and providers. Single payer is a funding mechanism where health coverage is provided from a single public fund. Employers and employees will both contribute graduated payroll premiums into the general pot. This money is used by the state to pay providers and facilities without limiting patient access or choice. Passage requires only one more vote. Convincing senators such as Senator Seward to support this bill is key to the health of New York. Once we have succeeded in New York State, we can move on to the cause of national single-payer health care. Thank you very much for your time and attention.